Hi everybody, Dr. Alan Arnette here. Well, I wanted to give a moment today to share with you something that I've been building upon over the last couple of weeks. At the end of last year, I made a nice video on how to relieve stress from the neck through yoga and breath practices. I have the how to do it and then the practice session loaded on my YouTube channel. Please check us out and go ahead and subscribe for us and hit a like if you do so that we can make more videos, so I can make more videos for you. But then I followed that with, in January, I had a nice anatomical video where I broke down the anatomy of the neck so that you could begin to see why it is that we need to spend so much time on our neck. And then today what I have for you is I have a case study where we have some labs proving that stress actually does break our body down and how the change of stress actually can bring it back up. So I'm going to introduce a few lab findings today. Some of you have had your labs done by your medical doctor and may be familiar with something called your A1C. Your A1C is a genetic measurement of your sugar processing, how your body manages sugar. You may also be familiar with something called glucose. Glucose is a measurement of the sugar in your system. Now, this is not a great measurement because if you eat, it's high, and if you don't eat, it's low, unless there's a disease. But the A1C is a great measurement. So I had a patient who was coming to me for health-related reasons, and I treated this person over a long period of time, and there were many different things from musculoskeletal to internal medicine to psycho-emotional challenges, and got her through a great deal of them. In fact, this is why it was so surprising that everything was looking great on her labs, everything was looking good in her life, everything was functioning really well, except that her A1C was starting to raise on her lab findings. No one could figure out why. She ate an excellent diet. She exercised regularly. She meditated, was even a nice person. She gave to other people. So it seemed puzzled, why would she start to have her A1C climb? Her glucose was not necessarily climbing. She does not have diabetes in her family lineage, so it was a bit of a puzzle. Well, I happened to have treated this patient over a long period of time, so I knew that there were times where she got into what I call busy stress. She's so smart and so engaged in many things that she had lots of different projects on her plate. And so I thought, well, that could be a form of stress in the nervous system, so why don't we run a panel? So as you will see, I've got a picture of her lab here showing that her A1C was high. And you will see here on the second test that her cortisol level, which is a measurement of the stress response in the body, in the mid-afternoons was above average. When I asked the patient, what do you do in mid-afternoon? She says, well, what do you mean? I'm usually busy. I've got lots of projects. I go, are you stopping and eating a snack? Well, sometimes I'm hungry, but I'm busy. I just keep pushing through. Do you stop and take meditations in the mid-afternoon? Well, sometimes, but oftentimes I have to push through because I'm busy. I said, I think that what your body is showing us here is that you're inadvertently putting yourself through a busy stress, and that's raising your cortisol levels, driving your A1C. Turned out that was exactly what was happening. We put together a protocol of acupuncture, meditation, and just a few supplements in the mid-afternoon in a very special regime I put together for her. And as you will see right here, in less than 2 months, the A1C came down 0.2 points. We see that her LDL cholesterol really precipitously dropped, which is a measurement of inflammation in the colon. You begin to see that some of these other factors here on the lab values are actually self-correcting simply because this main stress is off. So the reason I wanted to do this short video for you today is to say to you that we have ways to measure that stress really does break down the body and ways to tell when we're making success. Please let this video inspire you to say, wow, my stress may be more than I think. I need to listen to my intuition. And if that's not working, consider coming and having a consult with me. Remember to like us down there and to subscribe to our YouTube video if you can. We are looking to get this message out. I'm looking to get this message out to as large an audience as possible. From my heart to yours, happy healing.